I think this is a good decision by the FDA. It's based on recently accumulated data around the antibody or immune response in immunocompromised people who have a weakened immune system, as you mentioned, cancer patients, transplant patients, et cetera. So I think it's a good decision. It tells us a lot about where the science and data are heading. And I do believe that this presages a decision about a broader application of booster immunizations. You know, it's not that uncommon, right? Tetanus shots have boosters. And I think we always had the expectation that this might be the case.
And that was the former commissioner of the FDA, Dr. Stephen Hahn, on Mornings with Maria with me last week on Fox Business, praising the FDA's decision to authorize COVID boosters for people with weakened immune systems. Joining me right now is the president of Moderna. He is the leader of all research and development at the company. Dr. Stephen Hogue is here. Dr. Hogue, it's very good to see you this morning. Thanks very much for spending the time with us. You heard Dr. Hahn. Tell us about the need for a booster. How much protection does the Moderna vaccine give us? And will we all need a booster at some point?
Well, it's important to contextualize this in the face of the Delta variant and really the surge of cases we've seen. So, if you look over the course of the summer, I think we've all been surprised by the steps the virus has taken to evolve and get much, much better in the form of Delta and infecting people. And that's really what's driving the surge right now. So the vaccines are really effective, and that's the good news. In fact, if you look at the breakdown of cases, still almost overwhelmingly these cases are in the unvaccinated people. The number one thing we got to do is get those folks vaccinated. But as you said, Maria, there is breakthrough clearly starting to happen with the vaccine. And Delta poses a substantial threat to all of the vaccines and the durability of that immunity.
What do you make of these breakthrough cases? I mean, anecdotally, I have a few friends that had been vaccinated but got COVID anyway.
Yeah, I think Dr. Hahn said it well. It's not surprising that immunity would decline over time for a respiratory virus. If you think about it, it's not that different than when you get the common cold. We're used to getting the common cold every couple of years, and sometimes it can be a severe cold. And that's really actually a cousin to the coronavirus that's currently circulating. So you would expect over time that corona is going to be able to reinfect and maybe cause a disease like COVID-19. I think the surprising thing is that it's happening this quickly. Many folks in this country were vaccinated maybe 6 months ago. And what we're seeing is breakthrough cases starting to emerge differentially across the vaccines for sure, but really starting to emerge as a result of the Delta variant at about 6 to 9 months. And I think that suggests we are going to need booster vaccines to get through the winter.
Okay. I want to ask you more about this because I know that the vaccine loses some efficacy after 6 months. Let's take a short break and then zero in on the vaccine efficacy longer term. And then I want to ask you what else you're developing with this mRNA technology, including treating respiratory disease as well as cancer. We'll be right back with the president of Moderna, Dr. Stephen Hogue. Stay with us.
Now, our CDC and the present administration won't even acknowledge natural immunity, which is every bit as effective as getting the vaccination. And between the two, about 85% of our population has immunity. So we need to be dealing with that and working with that and giving people the actual numbers and letting them make decisions. Mandates.
And that was Dr. Ben Carson on the program last month discussing natural immunity. He, of course, is a specialist in neurology. I am back with Dr. Stephen Hogue from Moderna. So, Dr. Hogue, how much immunity does a person have if they've already had COVID? Will they need a booster shot as well?
Well, I think we don't know. We don't have the data on it. To be honest, I think we're still trying to develop data on how much natural immunity protects you, just like we are with the vaccines. But we do know when we measure the level of immunity in the blood of people who've been infected, it is lower than you're seeing certainly with the Moderna vaccine or the Pfizer vaccine, which would suggest that breakthrough cases are going to happen with natural immunity at least as soon as, if not sooner, than you're going to see with vaccines.
This is fascinating, and of course, I know that we're learning more about this as we live it. But you're saying that you're not surprised by these breakthrough cases, right? But you were surprised. You said a minute ago that it was happening as soon as it was, right?
That's right. I think again, you'd expect respiratory viruses to be able to reinfect people. Hopefully, not cause severe disease like COVID-19, but it's sort of the natural history of these infections. I think the surprising thing that we're all seeing right now is we're in the middle of a global pandemic. The virus continues to evolve and get even more virulent, even more aggressive. And Delta is an example of really a huge step change in its ability to infect people. And so with that step change, what you're seeing is really more rapid breakthrough. And I think that is the surprising thing from our perspective, is that the durability of the first couple of shots is really only looking to be maybe 6 months, maybe a year. Now, that's not terribly surprising that you would need a third dose. I think, as Dr. Hahn said in the other lead-in, that happens with tetanus, that happens with your flu shot every year, that you need to boost yourself to maintain high levels of protective immunity. But I think we were all hopeful that we were going to be able to stop this thing with the initial couple of doses. And it looks like the virus is going to fight back and require booster doses more broadly, certainly by the fall.
So I want to look at really the conversation taking place in the medical research community right now. And part of that conversation has to do with comparing the leading vaccines. This is a study which was reviewed by the Mayo Clinic. And what it shows us is that while both vaccines were highly effective during the period from January to June, 6 months later, in terms of the 7th month, that's July, the numbers actually drop considerably. And what you have is effectiveness against infection considerably lower from the 90% at Moderna. It goes down to 75%. But look at what happens to the Pfizer drug. It drops all the way down to 42%. This study suggests that the Moderna vaccine is superior to the Pfizer vaccine. I recognize that this is not peer-reviewed. We are awaiting peer reviews here. But what can you tell us about this study?
Well, first caveat is that Moderna is not involved in the study. We weren't a sponsor. It's independent research by the folks at Mayo Clinic. But I think you summarized it well. There is emerging evidence from this study and other sources that there is a difference in the durability of protection, particularly in the face of the Delta variant, at about 6 months between the two different vaccines that are otherwise very similar. I think this is consistent with the public comments by both of the companies about their phase 3 trials recently, as well as some other publications internationally, including from the governments in Canada, showing a slight difference in protection over time. I think the one last thing I'd want to say about it, though, is that while there isn't yet maybe scientific consensus around this, and really that's not the purview of any company, that's the general scientific community, even if there is a difference here and the Moderna vaccine is showing better durable protection against the Delta variant, we don't expect that will be permanent. And the truth is, as you pointed out, there is a little bit of waning already for Moderna. Even though it looks better, it is trending down. And we suspect that over time, maybe it's at a year, maybe it's at longer, you will see eventual increase in breakthrough cases even with the best vaccines, which is again why we think ultimately boosters are the best way to maintain broad population immunity so we can stop the pandemic, stop the economic disruption, certainly stop the death.
If you had 2 shots of the Pfizer, can you do the Moderna booster shot, or do you have to stick with the same?
Well, that's really a decision for regulators and public health officials to make. As a company, we will generate data, and we're conducting clinical studies actually exactly on that with the National Institutes of Health as well as governments internationally to provide information that shows you can do that. But again, the choice of whether that's appropriate is really up to the FDA and in the United States, the CDC.
And Dr. Hogue, I know that Moderna has been working on mRNA technology for 10 years. This is something that this company has been focused on, and you are also looking to apply that to other illnesses, such as other respiratory disease, as well as cancer. Tell us a little about that, how you might be able to tap into mRNA technology for other uses.
And thank you for that. We are actually well known for our work here at COVID, but for the last 10 years, we've been working on the technology platform to try and address all those diseases you just referenced. If you look at the history of respiratory disease, Our view for most of the last decade has been we need to do so much better in preventing the death every year that happens as a result of infections like flu or the common cold viruses that often actually lead to silent death in this country and internationally. So we've been working hard on developing solutions for that. Hopefully single vaccination, a single injection that you can get that protect you against all of the viruses, now including COVID-19, that actually lead to that death and disability. But we've actually obviously substantially pivoted to focus on COVID-19 for the last year, but we haven't stopped that work, and we're in the process of starting late-stage studies across a range of those other respiratory viruses. And then the same sorts of things, using mRNA to educate your immune system, something we can do in cancer. And so we're running clinical trials right now in cancer, trying to show we can teach your immune system what your cancer looks like, individual in per person's cancers, so that your immune system can attack it and hopefully reverse the scourge of that disease as well.
Amazing, amazing. Thank you very much, Dr. Stephen Hogue. We'll be watching the developments. We appreciate your time this morning. We will see you soon.